Hi, I'm Dominic.
I'm Ashley.
And I'm Michaela.
Today we'll be talking about malnutrition.
There are two approaches in detecting malnutrition. The first being interpretation of weight loss, and the second being physical findings.
And our second topic is talking about the challenges that dietitians face in diagnosing malnutrition.
And today we're going to be starting with the interpretation of weight loss. Hello there. Last night, a patient came into the ER with throat problems. We were requested to see the patient within 48 hours to analyze and interpret his nutritional status before any further treatment. Hey guys.
Hey Dom.
Hey.
We just got a new patient that has throat problems. We want to figure out his anthropometrics.
Yeah, let's go figure that out.
Okay, so now we have to calculate and interpret his weight loss. This specific patient is a male who is 6'2" and his current weight is 165. Now, what we do with that information is we compare it to the ideal body weight. To determine the ideal body weight, we take the first 5 feet is 106 pounds, and then every inch after the first 5 feet is an additional 6 pounds. And 6'2", that would be 14 inches over 5 foot, and adding that up, the ideal body weight would be 190 pounds. Now, it is indicative that his weight currently is way less than 190. So we determine the range by taking 10% of the ideal body weight and adding and subtracting that to find the low range, which is 171, which would consider underweight, and then 209, which is above, which would consider overweight. And this patient is less than the underweight range. Alrighty, this is the current BMI based on his current weight, which is 21.2, and this BMI is within normal range. However, it is not reliable necessarily based on health standards, but Ashley, my colleague, will go into that further.
So Michaela previously told us that his current BMI was 21.2, which is in the healthy range. But as we can see with our further calculations, it doesn't necessarily mean he is healthy and nourished. So right here, we're going to determine his percent of his usual body weight. And his current weight is 165 pounds, but from the data we got, his usual weight, which was about 3 months ago, was 187. So that is a pretty significant weight loss. And to do this calculation, we'll do his current weight divided by his usual weight. So that will be 165 pounds divided by 187, and multiply that by 100 to get a percent. And we'll see here it is 88.24%. So that kind of means that he's 88% of 100%, which is kind of like 100% would be his his current weight. Next we're going to calculate his percent weight change. And what we're going to do is take this number right here and subtract it from 100. And once we do that, we're going to get 11.76. Now this number is the percent of weight lost from his baseline. And his baseline is his usual weight. So in the past 3 months, he has lost 11.76% of his overall weight. And next, what dietitians do is we use this number and we put it into a table that was made by Aspen and like the nutrition and dietetics departments for detecting malnutrition, because sometimes it's not that easy and they wanted to make a table to be able to figure this out. So what we'll do is after this, you'll see how this number plays a role in correlating that percent change in the past 3 months.
Hello. So this is the diagnostic framework for the criteria for detecting malnutrition as defined by the Academy of Nutrition and Dietetics and Aspen. As you can see here, we have 3 categories: malnutrition in the context of acute illness or injury, malnutrition in the context of chronic illness, and in the context of social environment and social circumstances. Now, within each category, there is 2 subgroups, such as moderate malnutrition and severe malnutrition. Now, but for this, we're going to turn our focus to the interpretation of weight loss. So, if he or she is moderate malnutrition, they will be losing around 1 to 2% of weight loss in 1 week. And they'll be at 5% loss in 1 month, or a 7.5% loss in 3 months. In the severe category, there will be, if they're greater than 2% of weight loss in 1 week, or greater than 5% loss in 1 month, or greater than 7.5% loss in 3 months, then you know that they're severe malnutrition.
So my colleague just explained this chart to you, and now I'm going to reintroduce our patient. So our patient came in with throat problems, and that's why we looked at this column exactly, the acute illness or injury, because as of right now we're kind of thinking it's an injury. And through his anthropometrics, we measured an 11.76% weight loss in the past 3 months. Now, looking here at the interpretation of weight loss, we can see that he is over 7.5% weight loss in 3 months. So as of right now, we are going to mark this characteristic that he is severely malnourished in the form of weight loss. But there's also some difficulties in this, and we're going to be talking about that next.
So one of the difficulties clinicians face in interpreting weight loss is the BMI combating the data that is presented in this chart. The BMI for this specific patient was 21.2, and in the range of the BMIs, that is considered a healthy weight range. But based on the data that we found for weight loss, he's in the severe malnutrition category. So those two data points combat each other, so the clinicians have to use this as the primary source instead of the BMI.
So as my colleague mentioned before, she did the nutritional focus physical exam. And with that, we found that he was in the moderate range of loss of body fat and in the moderate range of loss of muscle mass. And this was due to the temporal wasting in his head, the loss of muscle mass in his biceps and triceps, and the high indentation in the clavicle. These are only 3 factors that we found which we can categorize him as in the moderate, which is severe malnutrition. Now I'm going to hand it over to my colleague Michaela to talk about some of the difficulties that dietitians can run into using physical findings.
Another difficulty that clinicians face is when doing their physical exam, some of the signs presented may not be due to nutrition-related things, such as the skin discoloration may be due to sun exposure, or the hair loss may be due to them over-dyeing their hair. Another example is when they lose an extreme amount of body fat, like in this example, is because maybe they are overdoing it at the gym. So the clinicians need to take this into consideration when interpreting their data. And the next thing we're going to interpret is the patient's diet for the diet history and seeing where they fall into that category.
So here our patient gave us his 24-hour recall, and he stated to us that since he has throat problems, he has not been eating as much as he normally does. So right here we can see that he has some soft foods like canned soup and chili for dinner. But since we're kind of just briefly looking at his diet right now, we're not exactly using the exchange list and calculating the amount of calories. Just by looking at this, my colleagues and I can tell that he's not eating enough for his height and weight, and that this may be contributing to his malnourishment characteristics that we'll see later on when we look at the chart.
So now that we have reviewed his anthropometrics, his 24-hour diet recall, and his physical findings, we had established that he is malnourished. And although he has 3 categories that will diagnose him as malnourished, you only need 2 characteristics to be present to be diagnosed. And being that he has 2 of them, he is malnourished.
It's important to know that they're malnourished when they come into the hospital, because we want to know throughout their stay of the hospital while their illness is getting treated if they're getting better, if they're getting worse, or if they're staying the same. So when helping the patient throughout their stay, we want to consider their illness. Some illnesses require that they get tube fed or that they can eat solid foods or other options. So like our patient, he has throat problems, so he's not able to eat solid foods as shown by his diet recall. He was eating scrambled eggs and soup and stuff like that. So we want to take that into consideration when going over his nutrients and make sure that he actually meets the goals to improve rather than decline in his status.
So some more facts on malnutrition diagnosing and nutrition in general is, why else is diagnosing malnutrition important? So one factor is hospital fees. And some people don't really realize this, but if they don't get diagnosed as malnourished as soon as they come in, that means that they don't get a nutrition assessment. And let's say that their illness was nutrition related, then they would never know that, and that would lead to longer stays at the hospital, and it would cost the hospital fees, the person fees. So we kind of just want to diagnose as soon as possible and make sure that their illness isn't nutrition related. And another thing is, what is the prevalence of malnutrition? As we can see here, 35 to 65% of hospitalized patients are malnourished. And this is why nutrition and dietetics is very important in the hospital setting.
So now we're going to present to you a case study. So now you, as a dietitian, what would you do in this situation? You have Jane, who came to the hospital last night. She was studying abroad for the past month, and she has returned 3 days ago. She has been vomiting and came into the hospital very dehydrated and was put on fluids immediately. Nurse notes that there were no fat pads underneath her eyes and prominent collarbones at entry. And as you can tell that she is dehydrated due to the vomiting. Now let's look at the anthropometrics. She's a female, she is 21, and she is 5'3". As you can tell, she's very small. Gender weight is 120 pounds, and she weighed 1 month ago approximately 126. So now we want you to calculate the ideal body weight, ideal body range of where she should be if she's not above or below, her ideal body weight percentage, and her percent weight change. So how much did she go from this to this? And lastly, her BMI, which as we stated earlier is not always a strong indicator, but it's always good to know and to keep in your notes something to look out for, because if they are below the healthy range, then that could lead to other problems as well.
So here's the first question that we want you to answer. Based on the data presented by Dom, is this person considered malnourished? And we want you to use that chart that we mentioned earlier, the diagnostic framework, to see how many characteristics this person is on the chart. So we want you to look at the physical findings, the percent weight change, and also the other categories, like is it an illness or a social problem that Jane is presented with. So here's some final thoughts that we want you to think of also. Can you think of any more difficulties pertaining to malnourishment that we may come across when we all become dietitians? So we thought of some, and we want you to think of if there's any more that maybe you can figure out.
Alrighty, now for question 2. It has been presented that there is an issue with obesity in the United States. But the second question is there a correlation between malnourishment and socioeconomic status in the United States? If there is, describe the relationship. If there's not, explain why.
So for question 3 is related to what if the patient has improved their nutritional status? So if the patient has not improved in nutritional status, are they able to be dismissed from the hospital? If so, please give an example, and if not, we would like your explanation as to why not as well. Hi, I'm Dominic.
I'm Michaela.
And I'm Ashley. And this was our video on how to detect malnutrition and the difficulties that clinicians face when detecting malnutrition.
And we look forward to your response on those questions.
Take care.